Assalamu alaikum wa rahmatullahi wa barakatuh. Dear students, welcome to our class. So, inshallah, today we will continue with this topic disease. So, what is disease? A disease is basically a condition that affects the normal functioning of the body. Okay, a condition that interferes or affects the normal functioning of the body. It could be anything like cold, sore throat, anything that affects the normal functioning of the body is called as disease. And this are categorized into two types basically: congenital diseases and acquired diseases. Congenital diseases are some diseases that are present since birth for some individuals, and acquired diseases are that happens after the birth. Okay, and under the acquired diseases, there are two types of diseases. One is communicable diseases, other one is non-communicable diseases. Communicable diseases are that can be spread from infected person to another person. Sorry. And non-communicable diseases are that cannot spread from one person to another person. Okay. And communicable diseases, as I told, it can be transferred from one person to another person either by direct or indirect contact. So here they have given how the method of transmission happens through direct method and how it happens through indirect method. Fomite. Fomite is anything, any non-living things through that the disease is spread. That is fomite. Any non-living disease, any non-living things that can carry the microbes or the infectious organisms. Some vector like mosquitoes. Vector means an living thing that carries these pathogens. Okay, so you can read about this here. And droplet infection is tiny droplets of mucus when you sneeze, when it goes to or when it falls into another person, they can get the infection. Okay. So some common communicable diseases. First one is amoebiasis. It is caused by Entamoeba histolytica. So it infects the large intestine, and how the transmission happens, they have given here by air, by housefly, and all those things. And symptoms: abdominal pain, and all these things. And prevention, you can read about here. Okay, prevention and treatment. Like that, they have given for different diseases, different communicable diseases, their names, what causes it, and what is the symptoms. Okay, everything you can read here. Okay, you have to read here. I'm not explaining this because it's just simple points. You can just read and understand. And if you don't understand any words, obviously it's English. English is not your first language, so you have to refer dictionary. Okay. So you can see they have given multiple communicable diseases and the causes and symptoms, prevention and treatment, everything they have given in this table. It is very important. In the exam, it will come, so you have to read it. Okay, read it multiple times and understand it, inshallah. And the next topic is non-communicable diseases. Some diseases like heart attack, hypertension, diabetes, obesity, this they cannot communicate from one person to another person through any infection. So these are all non-communicable diseases. There are some causes like sedentary lifestyle. There are like sedentary, no physical activity, no indoor games, lack of exercise, and all these things. That is sedentary lifestyles. Eating habits, eating a lot of fast food and fat foods and a lot of sugars. All these things lead to obesity. And type A personality, those who are like always focused on doing better than others rather than doing their best, easily they get angry or frustrated. Okay. And family history, if they have any family history of heart disease and diabetes, they may get these diseases. Okay. Their prevention they have given here. Okay, it is easy to understand. Just read it, inshallah. And the next one is immunization. That is protection against certain communicable diseases. So our body ability to protect itself against the foreign agents, including the disease causing organisms, okay, is what is called as immunity. So immunity is our body's ability to protect itself from the foreign agents. So there are two types of immunity. First one is innate immunity and second one is acquired immunity. Innate immunity is since the birth we have that immunity. Okay, like skin, the mucous membranes, and hydrochloric acid in our stomach, and the white blood cells, which engulfs the foreign particles and destroys them. These are like innate immunity. It's already present. Acquired immunity is develops in a one's lifetime by producing antibodies. Antibodies they kill the antigens. Antigens are the foreign bodies that affects our body. Okay. So antibodies are proteins. They are produced by the lymphocytes. Lymphocyte is a type of WBC, that is white blood cells. Okay, each antibody will be specific against specific antigens. Okay, so antibodies they can remember certain antigen. Okay, once an antigen infects a body, then antibodies are produced for it. Then the antibodies will remember. So in the future, once again, if the same antigen comes, then the body will uh, produce the appropriate cells then to destroy that antigen. So that is the memory of the immune system. Okay. So the acquired immunity can develop either naturally or artificially. So naturally is after infection, the body produces the antibodies, then they remain in the body. So that is natural acquired immunity, and it can be used in the future to kill the same pathogen. Artificial acquired immunity is like vaccination. You might have heard about vaccination, like polio vaccination, all these things. So vaccines are basically inactivated or weakened pathogens. Those pathogens they cannot cause diseases. Okay, they are inactivated, so they are given to the humans. So the immune cells, what they do is that they recognize these pathogens that are weak pathogens, and they start producing antibodies for this. Okay, so now if the regular pathogen comes into contact with the body will produce the antibodies because due to vaccination, the immune cells remember how the antigen looks, so they produce the proper cells and destroy the pathogen. Okay, that is the artificially acquired immunity, that is vaccination. So it can be active or passive. Active is our body develops antibody against the pathogens and it takes some time to show the response. Passive immunity is ready-made antibodies are given, like from outside antibodies that can kill the pathogens. They are given and they kill the antigens. Okay. So the mother's milk in the initial 1 to 2 days, it is also called as colostrum. It is very essential for the newborn infant because it contains abundant maternal antibodies to protect the infant. It gives the quick immunity. So the primary immunization is the vaccination that has to be given to children up to 24 months of age and to the pregnant women. Okay. So here they have given the chart like at what age the vaccination has to be given in India. Okay, national immunization schedule in India. Like primary vaccination, there's BCG vaccination against TB. They give during the birth, after the birth. Then the oral polio when they should give, and during the birth. Then after 6 weeks. Then after 10 weeks. In the, after 11 weeks. All these things. They're given chart. Okay, like for pregnant women when to give. And all these things they've given. It is the national schedule for vaccination. And the next topic is first aid. So all of us know that first aid. What is first aid? The immediate care given to the victims of an accident or sudden illness before the medical help arrives is called first aid. This is the definition for first aid. Okay, like suddenly something happens, emergency, and before the actual medical help comes, we do some certain aid, that is what is called as first aid for shock. When a person is hurt, hit, a person experiences shock and they look pale and tired. So these actions have to be done as a first aid. Okay, loosen the clothes, calm down the patient because they are shocked, they are in the shock, their mouth feels tight, then give a clean and wet cloth to suck it. Okay. The next one is severe bleeding. What happens? What you should do? What first aid you should do when severe bleeding happens? Keep a sterilized dressing, that is sterilized cotton and or clean kerchief, and press directly on the wound with the thumb. Okay, and the victim should lie down and elevate the bleeding part, like it should be kept up so that uh, uh, the blood flow is minimized, and you should call the doctor for every first aid. For nose bleeding, you can read about here what should be done. And dehydration. When our body loses a lot of water, then dehydration happens. So what should be done during dehydration? Water should be given. There is something called as ORS. You might have heard about it, oral rehydration solution, that has to be given in regular intervals. Okay, ORS packets are available, free cost at the government health centers, and doctor should be consulted if needed. Okay, and the next one is animal bites. What should be done when animal bites it, whether it's dog or cat or other animals? So first of all, wash the area of the bite with the soap and water. Should wash it well, and after that, in case of a dog bite, then anti-rabies injection has to be taken from a hospital or a qualified doctor, and the dog has to be kept under observation for a week to check for rabies. Because if the dog is infected with rabies, then it will die within 1 week. Not because it bites it, but because of the rabies infection. So the dog has to be kept in under observation. Okay, so if it dies within 1 week, then it is known that the dog was infected with rabies. So the victim has to be given proper medication, proper injections. Okay, so what should be done if a bee stings? Okay, then burns. First aid for burns depend upon severity of the injury, like how much it is burnt. Um, the injured area should be placed with cold water to reduce the pain and tissue damage, and a dry, sterile dressing has to be kept. Do not break any blister form. If any blister form due to burn, it should not be broken. If severe burns destroy the deepest layer, so cover with clean towel and cloth to prevent infection and immediately rush to the hospital. So chemical burns, if there are any like acids or alkalis, they should be flushed with large amounts of water for at least 10 minutes. If there are any chemical burns, that is for burns. If so, fractures and dislocations. So fracture is break in the bone, and dislocation is when the bone end moves out of its normal position. So the signs include pain, tenderness, and swelling around the injury. Okay. So what needs to be done? Do not move the victim until expert help arrives, because if you move, then it will worsen the condition. And apply a splint in that area if victim has to be moved. Okay, splint is like this. Splint is basically a support which can be made by a padding, a stick or scale, umbrella or any rod with a soft cloth. You tie it so that it does not move the part where it is broken or dislocated. Okay, and as I told earlier, do not move a person who has suffered neck or spinal injury, because it will worsen the condition. You should call the expert and wait for the uh, medical help to arrive. The next one is prevention of substance abuse. Substance is basically anything drugs that causes mental damage, so that is called as abuse. How the drugs are used in a wrong way. So what is a drug? Drug is basically a chemical substance that changes the way our body works. So some chemical drugs are used for medical treatments. They are legal drugs, and some drugs, they can be illegal drugs. They are used illegally by people for wrong usage. So if the drugs taken for other than the medical uses, uh, for pleasure or false sense of happiness, it is what is called as drug or substance abuse. Okay, some common abuse drugs like narcotics, opium, morphine, all these things they have given, and for what they are used is all given here. You can read about it here. And tobacco is also one of the drug. It is very common in India. It should be avoided by people. So smoking in public places should be banned, and prohibitory signs should be kept in the public places. All these things should be done. So when people use drugs and they start to use more and they get addicted to it because they feel uh, the sense of pleasure. And some people, when they are depressed, they to overcome the pain of boredom, fatigue, they use these drugs. So that should be avoided. Okay. So drug addiction, how it happens, how the dependence forms, how they become dependent to it, and withdrawal symptoms, everything happens. So drug abuse, when they use drugs, it leads to drug addiction. They get addicted to it, and after developing tolerance and dependence, okay, they get dependent to this. Withdrawal syndrome is mm, when the drug is abruptly stopped by the person who has been taking it for a long time. Then the body will react to it, like anxiety comes, abdominal pain, sweating, and all these things happens initially. So these withdrawal symptoms make it difficult for the user to give up drugs when they are used to it. So the effects of drugs, short-term effects, they appear instantly within few minutes after the intake of the drugs. Long-term effects include mental damage, physical damage. All these things are long-term effects. And prevention, they have given many prevention methods. Like a person has to be active and avoid any pressure. Choose your friends wisely. That's why, as youngsters, you should choose your friends wisely. You should only hang out with good people. As Muslims, you should be active and enthusiastic, and you should be akhira minded. You should be away from things that are prohibited by Allah and His Rasul. So you should be optimistic and have a positive outlook. You should not worry about any failures, whether it is exam failures or any failures. You should not worry about it. You should be confident because this life is full of tests. So you should not go to any shortcut like this to be out of the stress or something like that. Okay. And also, if you see some of your friends doing all these things, then you should help them, you should advise them, you should tell their parents that he's doing like this, so that you help your friends. Okay. And you should tell the elders, your teachers, that this person is doing like this, so that you help your friends. You should not participate or you should not hide what he's doing. Okay. Because it will help him. The elders, they will help the person who is addicted to this, whether it is tobacco or other drugs. The elders will help the person to get come out of it. Okay, so they have given what is the danger signs. So if the person is sudden change in work or school attendance and quality of work and all these things, some danger signs. Okay, so professional and medical help should be sought. Okay, then we will see about diagnostic techniques. Diagnosis means to find out a disease. Okay, for example, if you have heart attack, then how it is to be diagnosed. if a person has um, like diabetes, how the doctors find out the person has diabetes. That is what is called as diagnosis. The first one is X-ray. You might have heard about X-ray. That is radiography. What happens is that a beam of X-rays or electromagnetic waves of very short wavelength, it is passed through the body, and then it falls on the X-ray sensitive film and produces a shadow image of the dense part of the body. If it's like tumors, then it absorbs the X-rays, then it will appear as the light areas in the film. You can see if it is a tumor, then it appears as a light area. Okay. So hollow organs and fat tissues, they absorb X-rays in a lesser extent, so they appear as dark areas. Okay. Um, so what are the uses for bone fracture, dislocation, and for TB in the lungs? This X-ray is used. And the next one is ultrasound imaging technique or sonography. So what happens is that there is something called as ultrasound. That is the frequency of above 20 kilohertz or 20,000 cycles per second. That is the range of the human hearing. It's the range. So diagnostic ultrasound uses 1 to 15 megahertz of the sound. Okay. So what happens is that this ultrasound is passed and these waves get reflected and scattered to different extent in our body tissues depending upon the density of the body tissue. Then finally the reflected waves are received and processed by a computer, and then the computer forms a visual image. Okay, so that's how this ultrasound imaging works. So it is a safer method of imaging, and it is safer than radiation because in radiation there might be some issues. So it is safer than the uh, radio imaging, and tumors also can be detected. Okay. The next one is MRI. MRI is magnetic resonance imaging. So it produces high contrast image of soft tissue. In our X-rays, you cannot X-rays and other imaging techniques. They are weak. You cannot uh, produce the image of our soft tissues inside our body, like muscles and cartilage, ligaments, and blood vessels. But through MRI, we can make the image of our soft tissues. Okay. So what happens is that there is a center of a mission. If you type MRI mission on Google, you will see how it looks. So it will have a powerful magnet. So it creates the magnetic field. So the protons of the hydrogen molecule so align themselves in this magnetic field. Okay, once they are aligned in this magnetic field, once this magnetic field is turned off, the energy is released from the protons. Then the energy released from the protons, they are detected by the detectors, sensitive detectors. Then it is fed into a powerful computers to generate the images. Okay, any part of the body. The image of a different tissue can be contracted depending on their water content. Okay, that also can be detected. So patients who have metal implants in their body or pacemakers, they cannot be imaged. Okay, it is dangerous, so they cannot be imaged. So we have completed this lesson, Alhamdulillah. So you have to send me the notes for this, what you have learned, this part till here. Okay, and also you have to do your terminal exercises and answers to the in-text questions. Students, we have completed this lesson, and inshallah, in the next class, we will go to the next lesson. We have 9 more lessons to complete, and we have only almost 2.5 to 3 months remaining in our academic year. So please study well. Your exams are approaching. You will have to complete the portions. You have to study a topic multiple times and write it down so that you understand it better. Okay. So this is my advice to you. And also concentrate on this in-text questions and terminal exercises first, then study everything. Okay, first concentrate, give importance to this answer in text questions, terminal exercises, questions. First give importance to this, then go inside the lesson and study and cover everything. Okay. Okay, we have completed this lesson. See you in the next class. Assalamu alaikum wa rahmatullahi wa barakatuh.